Good evening, everybody. Hope you all are well. If you can hear me, can you please put the thumbs up? I don't know if I can see. Okay, thank you, Nasim. Perfect. Just my other colleague is not here at the moment, Ranzo. I'm just gonna start in the meantime. Just not to waste time. So yeah, so welcome again, everybody. My name is Ridaa. I'm a first year medical student at UCT, and welcome to Med Exam Slayers. So basically, Med Exam Slayers it started in 2022, where my main purpose or aim is that came from the fact that not much is being done from lecturers to adequately prepare us for the examination, for the MBCHB examination. So this initiative I've started with the main aim of tips for the year, exam preparation, and tips for the examination. And yeah, and basically to make your year a success. Okay. And it's basically for pre-clinical students by clinical students. Okay. So prepping for MSHB year 3. So welcome to third year. As you can see on this image, most of the time it's going to feel like you're on the edge of a cliff, specifically in semester 5 when you introduce to neuro, because obviously that the workload um, is obviously intense, and you all have experienced that from second year. That second year I've showed you the amount of workload that they actually give you and you actually have to memorize for the examination. So in semester 5, it's very the same type of feeling like you're almost at the edge of the cliff. However, the good news is going into semester 6, it kind of get much better and things actually begin to make more sense. Okay. So yeah, applying to medical school wasn't hard at the start. Second year felt like this, and obviously semester 5 will also feel like this as well. But I just want to reassure you all that it's gonna get better, right? It does get better. Um, Things begin to make a lot more sense in the clinical years, and it does like it gets more fun, to be honest. Okay, so what are the expectations for year 3? So basically, these are your courses for third year. You have infant health systems, that you're doing semester 5. Becoming a doctor, so that's your family medicine and clinical skills. That's in semester 5. Languages is also in semester 5 only. And after semester 5, when you come back from the vacation, you do something called a special study module. It's a 4-week course. And then after that special study module in semester 6, you do only one course called Introduction to Clinical Practice. So basically just like a brief rundown of the courses, what to expect. So for integrated health system is basically the exact same where you're going to get your PBL cases as well as all your learning objectives and going to PBL. I know it's for some it might, I know for most of us, obviously, we do perceive it as a time waster. Much should be done on PBL as well. But anyway, there's nothing that we can do. But um, the cases that you do is anemia, leukemia, diabetes, as well as neurology. And under neurology, there's lots of sub categories such as stroke, trauma, um, so it's stroke, it's trauma, there's fetal alcohol spectrum disorder, amongst others. For clinical skills, they introduce you to the all the different types of neurological examinations. But also you still have to kind of you are still tested on your work from second year. So still your cardiovascular, uh, respiratory abdominal exam and general exam. and that's all fall under Gen Med. Okay. For family medicine, it's very similar structure as second year. Breaking bad news, motivational interviewing, your three-stage assessment, your so it's your how can I say the individual clinical and contextual, and then also your subjective. Your SOAP model is very important. Your subjective approach, objective assessment, and planning. So just try to keep that in mind when doing family medicine. Okay. And family medicine and clinical skills is where you can actually score a lot. Okay, and especially this semester. Languages, again, languages is very similar structure as second year, um, with very similar structured dialogues as well. So giving the patient history, personal history, social history, family history, medical history, giving a diagnosis, breaking bad news, and fair order the patient. Then, when you're done with semester five, you go to the special study module. Now, this special study module, basically, it's 4 weeks between semester four and semester five. It's after the holidays, okay? So you choose a study you want to be part of, and you work alongside supervisors. So let's say, for example, in my project I had for my special study module, the topic was transforming the undergraduate curriculum, and my supervisor was the dean of the faculty and the deputy dean of the faculty, and I was specifically interested in transforming PBL, problem-based learning. So I had to do a literature review um, for that particular special study module. And that literature review is what they actually mark for your special study module course. Some students have to do a case report that they have to write up at the end of the study. But basically, a special study module, you work alongside a supervisor and you assist them with their research or their project. Okay. So yeah. And then also a nice thing about the special study module is that on your transcript, it's either pass or fail. Similar to languages, it's a pass or fail, so it doesn't get graded. Moving on to semester six, introduction to clinical practice. So basically, the good news is there's no more PBL. Yay, yay, yay. Right? There's no more PBL. Some of the disciplines that you go into is adult health. So adult health is more about like it's very like similar to like the clinical skills that you do in semester 3, 4, and 5. Yeah, but you learn a lot about like you start to see patients as well in that block, and you do case portfolios for adult health, women's health, perinatal health, as well as mental health as well. So it's kind of introducing you to the clinical platform, introducing you to actually seeing patients. Okay, with women's health, yes, looking to into the human reproductive system, interacting with the patients as well, and learning about, for example, cervical cancer, termination of pregnancies, etc. With perinatal health, that's basically looking at the newborn baby. So that's looking at the pregnant woman. So you get obstetrics, that's known as the pregnant woman. So learning about that, and also about the newborn baby, it's also called neonatology, the study of the newborn. Okay. And it basically sets the foundation for what's going to come in year 4, 5, and year 6. Mental health, again, that's psychiatry, psychiatric illnesses, mental health conditions, delirium, dementia, depression, anxiety, amongst others. In clinical skills, it's a very fun block. It's the most, how can I say, it's the most fun block out of all those blocks is clinical skills. You go to emergency base, you learn how to draw blood, you learn how to do injections, you learn how to do CPR. Yeah, it's just fun. You do portfolios, as I said, and you only do one MCQ at the end of that entire semester. Okay. And there's only one OSCE for clinical skills. Okay, so yeah, that's in semester 6. my reflections of third year. So, based on my entire third year, the main advice I give you all is self-care. Medical school, medicine can be very daunting, very, very challenging, very demanding as well. Just don't forget to take care of yourself because, I mean, we are growing into adults and we are all going through the transition into adulthood as well, getting to know ourselves better, self-awareness, and asking lots of questions about ourselves. So very important to take care of yourself. So my challenges personally was feeling very overwhelmed, especially in semester five. Neuro was just too much. Always felt anxious, and I was also battling with academic issues. Some of the things that I can give you, basically what I learned from those challenges is that I always plan my week ahead and prioritize effectively. So at the beginning of every week, I would plan out my week. I'll go on an Excel spreadsheet. I'll go, okay, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. Every Friday, Friday nights are my off days. And the moment you plan your week, you actually take control of your week. And you can even plan every day as well. So at the start of the day, you divide your day into different portions. And again, always make time, even if it's just 30 minutes or 30 minutes to an hour of non-academic um things like just to relax or to chill or go for a jog or gym or whatever. Uh, I also found a study plan that worked for me. So basically, there's a lot of study methods that do help. So my advice is always just find that method that works for you. And one method might not work for all the courses. So just play around with it and find a study method that works for you. Going over past papers do help a lot throughout the entire year. So look out for those past papers. We also provide you with some sessions, revision sessions with examination. So please join in those sessions as well. Speaking, connect with a student, senior student. That is so important. Just speak to them, ask questions. Don't be afraid to ask questions because the senior student has been there and done that. So they will give you really solid advice. And I spoke to a final year medical student and he told me going over past papers, that's like one of the main things. And to be honest, it do actually help a lot. Last but not least, reach out to Ms. Nkosi Malala at Student Wellness. So if you put in her name in Outlook, can send her email, hi Ms. Nkosi, I'm not feeling well, I'm feeling stressed, I'm feeling anxious. Please help, please connect me. I would like to book a session with you. She's like the mother of the Faculty of Health Sciences. So and she is extremely helpful, and she will even refer you to the different avenues and other options as well. Okay, some study techniques. I don't want to take so much time because I just want to see if my colleague is here. Yes, it answer is here. Because Zoom do have a time limit. Okay. So basically I just wanna run through this effective study strategies. So usually if you find yourself just rereading the work, just highlighting the work, just summarizing the work, it's a very low efficacy. Moving on to the moderate effective learning strategies, making mnemonics. Okay, that's very good. Explaining the work to yourself and also doing mind maps. And then incorporating that into the highly effective strategies, and that is making questions for yourself, right? Making questions for yourself and um, always testing yourself and reviewing the work, and then in different time periods, and that's called distributed practice. So also known as spaced repetition. Anki cards do help a lot. You can also ask senior students if they have Anki cards that they have made. Osmosis videos on YouTube, that's very helpful. And there are many other um, basically platforms online that can actually help you to make mind maps as well if you're a mind map person. Okay. Okay, moving on to this. So these are some videos that you can watch on study tips. A synopsis of those videos is that try to do more active studying than passive studying. So what I do, I first do passive studying, meaning I read over the work first, and then afterwards I will actively study. So actively studying is, okay, so passive studying, I will read over the work and make questions for myself. If I don't make questions, I will just, when I do the active studying, I will go to the learning objectives and I will basically see if I'm able to answer the learning objectives without looking at the work. So you can also do that as well. And going through the learning objectives is very important. That will make you feel, how can I say, comfortable to what you must know for the examination. If you can teach it, you know it. So try to teach yourself, teach someone, have a group, teach one another. Active recall and spaced repetition, very important. Anki cards, flashcards, and then once again, make questions for yourself. So there's a graph that shows you the effect, the why spaced repetition is highly effective. And then also just want to mention the Pomodoro technique of studying. So it's very unhealthy to study straight for 6 hours and taking absolutely no break. The healthy way of studying is studying for 25 minutes, taking a 5 minute break. 25 minutes, 5 minute break. 25 minutes, 5 minute break. 25 minutes, 5 minute break. And then after that, you take a longer break for like maybe half an hour. And then you do the same cycle again. And the Pomodoro technique is very, very useful. Okay. It kind of gives you opportunity to study for much longer period. And yeah, keep calm and slay the year. It's just some motivational quotes that you can use every day. I would like to give over to my colleague, Riranzu. I'm gonna make you
Mm. Thank you. Thank you very much for that great presentation. I'm Ransom Curry and I'm part of the intercalated honors tract. I'm currently doing my honors year. And just a bit of advice in terms of what I believed has worked and didn't work. But I'm just going to be brief because I'm aware that there isn't much time. So I think what is really, really important is for you to be able to manage your time. If you can really, really work through that now, it's really gonna help you a lot. First semester is quite hectic, and I know there's a certain feel around neuro coming up, and some people are feeling a little bit stressed about that. So just make sure firstly that you're really good at managing your time, and just making sure that you use external resources, YouTube videos and all of that to sort of like guide you through your learning. And work with a friend. Don't go through this journey alone. Have people to work with. I mostly want to speak a little bit more on clinical skills and family medicine because that is where you can just easily get a distinction if you really want that distinction. So for family medicine, how you've been doing it, um, making sure that you go through your learning objectives because you guys have went through second year, so you do know the importance of making and answering those learning objectives. So I think really, really make sure that as you work through your work each and every week, you actually work through your learning. So I'm just going to share my screen a bit just to give you guys a little bit of a an example of how I sort of kept organized. So managing your time, that's the first thing. But another thing, just making sure that you're a really organized person. Just make sure that you organize your work very well. So you know that you have for each and every week you have a different topic that you're working through, and you have your lecture. So there's your lecture, and here are your learning objectives. And these are all the papers that you have to read. And hopefully you do this on a Sunday so that you're able to have everything done at least by Sunday so that during the week you can focus on other things. And what's important is just to make sure that you answer those learning objectives. So you have them there, you can do a table, you can do a Word document, whatever really works for you. So that day before the exam or a week before exam, you guys know that you write your exams from Monday to Friday. So that Friday or that week before, you know that you're just compiling all of your learning objectives in one document, and then you're just going through them rather than just trying to go back and trying to answer all of them, and it's going to be very stressful for you. So please work as you go. Don't leave things for the last minute because it's really gonna overwhelm you. So just try and manage your time, be organized as much as you can, ask for help, work with others, and most importantly, really, really enjoy this journey. Second semester is going to be a little bit more um, easier, not really easy, but a little bit more fun and relaxing. So every time you this semester and you're asking yourself, "Oh my God, that's really difficult," just tell yourself, after this, things are going to be a lot more easier, and definitely they will be. So in terms of clinical skills, just have a friend, practice. Again, don't leave things for the last minute. Practice with your friend. Maybe you can decide every Sunday be practicing, or every, I don't know, every two times a month. I don't know. You guys can really decide on that. You are gonna have OSCEs where you're gonna do neuro exams, and it can be quite frustrating to try and find your reflexes and all of that. So that's why it's important for you to practice. If you get a good mark on your OSCE, you don't have to worry a lot about the MCQ. Obviously, it does hold a lot of marks, but at least if you have good marks from the OSCE, you just have to work a little bit harder for the MCQ. Um, so yeah, that's really it from my side. If you are part of the intercalated student, or you know someone that is, I'm more than welcome to take you guys through that or explain whatever resources and all of that. We do have a group, and hopefully we're gonna have those individuals join. But yeah, that's it on my side, and really enjoy this year. Make it yours, make the journey fun. And yeah, you guys are almost there, you're almost to clinical, so that's quite exciting. Thank you very much, Rita.
Thank you so much, Riranzu. And yeah, that's the end of the session. Do you, does anyone perhaps have any questions? Okay, cool. Take it that there is not any questions. If you do have any questions, you're most welcome to ask in the group chat. And yeah, hope you all have a great year ahead. Just keep positive and go for it. Okay, and just make the best of the year, make the best of your journey. And yeah, all the best, everybody. Okay, bye.
Bye.